folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to fix knee pain in seconds, and this does work. We all know that, when you get pain, and my wife was a good example of this, you don't have time for this. I mean, I remember
right.
An office manager too was having knee pain. She's like, I don't have time for this.
Right.
It's like, so we're going to show you stuff that you can do throughout the day. It doesn't take very long, seconds, and hopefully it'll give you some relief.
Right. Now, this isn't knee pain like if you fell down on a concrete.
No, not traumatic pain.
Right. This is that knee pain that comes for no apparent reason. It hurts when you stand up or when you walk, and you're kind of wondering what's going on with it.
Very common, and as you get older, you might be getting in your 40s and 50s, and all of a sudden knee pain just shows up, and that could be the cartilage just kind of deteriorating on you.
Right.
A little bit,
the aging process is starting to catch up, unfortunately, but this can help.
If you are new to our channel, by the way, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. I'm not sure when this video is uploading, but at some point, when you want to go to the Facebook.
Oh, you went out.
Yeah, Bob and Brad, because we're giving away something. When this video comes up, I don't know what it's going to be at this time, because this might be in the future.
Oh.
We're going to be giving away something big, so go to Facebook, and we'll also probably have it listed in our description.
Right, not just like shoelaces. This is something much
big.
better.
I mean, to give you an example, the first week we're giving away a mattress.
Right.
But that might be done already by the time this comes up.
Yeah, that's how Facebook. I mean, that's how it works.
That's how it works. Yeah. All right. The first thing you want to do when you get knee pain, and this is almost universal in most instances, you want to try to decrease the weight on the knee. And to do that, especially if it's fairly severe pain, you probably want to, just for a while, maybe use a crutch or a cane.
Sure.
My wife was completely resistant to this.
As many people are.
Yeah, until she got so bad that she was forced to. In fact, this is I don't know if this is the crutch she used, but she used these padding. Because one thing, when you use a crutch a lot, it's amazing how sore underneath your arms gets.
Right.
So we actually you can get these crutch pads, and so she went around with just one crutch like this, which was better than a cane to her, because a cane really denotes that you're old. But this, you're going to have to answer a lot of questions, because people are going, what happened to your knee?
Right, right.
But if nothing else, if you can at least do it at home.
Sure.
So
get some weight off while you're just less irritation, and just. We've got some good videos on this, but if it's your left knee, you're going to use the crutch or the cane in your right hand.
Yeah, because the crutch is there when the leg's out there.
Right, right.
The other thing is, let's say there's no way we're listening to you, Bob and Brad, but another way to decrease weight on the knee is by avoiding stairs and avoiding hills.
Sure.
And those things you can often do. You can take the elevator for a while, or if there is one or something.
Right, right.
So all those things increase stress on the knee. So while you're getting we're trying to get it to calm down.
Right.
And a lot of times if it calms down, it stays calmed down. All right, next thing, you're going to want to regain movement. A lot of people, especially as you get older, there might be a lack of motion. You might have either a lack of flexion in the knee. Let me show you what that looks like. So if you're laying down, you can kind of compare one knee to the other and see how well it bends. Or you can do it with sitting too. And if you find one that doesn't go as far, and that's the painful one, you're going to want to try to restore that flexion. And I'm going to show you one way right now to do that. So what you can do is you can go onto a chair like this. Let's say this is my painful knee, and it's lacking flexion. So I'm going to put it up like this. And you can first start just even doing gentle rocking back and forth like this, just to get a little more flexion. You're trying to avoid pain. I don't want you to, go into where you really get sharp pain. You can have a little bump into the pain. You can get, a little bit of pain. Then you're going to actually try this movement here. You're going to actually grab the lower bone here, the tibia and the fibula. There's two bones down here, and you're going to turn them. You're going to turn them towards the other leg. So if I'm on my right leg, I'm going to turn them towards my left leg. So that'd be counterclockwise, right, Brad?
Yeah, and you can help by turning your toe in as well.
Yep.
And that'll give a little direction.
And then you're going to bend while it's turning. And that's going to, a lot of times, that's going to help get things back in place, and it's going to help aid the movement.
Right. So you do the turn your toe in. As long as you can bend it farther with less pain, you're right on. You want to keep working it. for some reason, if it
It hurt-
increases the pain and you can't go as far, that's a red flag.
You absolutely don't do it
Then
then.
you need to go to the next step.
So what's nice about this is you can, rip off a good set of 6 to 10 of these, and you can do these every hour if you want.
As long as they give you that kind of response, a good response.
And if I'm on this leg, I'm turning it clockwise now because I'm turning it towards the other leg, and I'm doing the same thing there.
Sure.
All right, Brad, do you want to show how about regaining extension, or should I do that one?
Well, I'll do it because they might be able to see it better with
on
the
the pants.
stripes. You know, I'll flip this around.
Yeah.
So if you're in your chair and you've got a stool, any type of stool, this is nice because you can go 2 different levels depending on what you feel
Yep.
comfortable with. But let's say on this leg, you can see that I can't get full extension. And then you look at the other one, you can see it'll drop right down. So, and that, oftentimes is the case with a sore knee that comes on without, trauma or falling. So at this point, you want to get it up on the stool. You could do it on the floor. Works a little better on the stool. Above the kneecap, you bring your hands here and you gently push and try to extend it more. Now, you might want to turn your toe out and see if it goes a little better that way or in.
Yeah, because sometimes it does work. Again, my wife is an example. She did better when she turned it out.
Sure, yep.
And it's really funny because a lot of times you may not even realize that knee doesn't straighten all the way. But when you compare the two, you'll say, oh my gosh, it doesn't straighten all the way.
So just to show it, here's my foot straight. You see, you'll do this pressure on, pressure off, 5 to 10 repetitions. Or you can make it go this way or in. Whichever way, you get better results, less pain, more range of motion. Let's say by the first one, it hurts a little bit. And then by the 4th or the 5th one, it's like, oh, I'm getting farther. It feels better. That's the green light,
That's
Bob.
the green light, thumbs
keep
up.
working it.
It could also be if it feels better after you've done it.
Right.
Maybe, while you're doing it, it doesn't feel the best, but when you get done, it feels better.
Right, you're walking around and it's like, oh, that's better. Then these are all little tricks of our trade, so to speak.
Yeah, and he said pressure on, pressure off, because the reason you do that is it tells you how long to do it. So you
Right.
say pressure on, pressure off.
There you go. As opposed to just holding it for 20 seconds.
Yeah. It's real calming, isn't it?
Right.
Pressure on, wax off.
There you go.
Okay, the other next thing, number 4. We got 5 of them here total. Brad's going to show the patellar stretch. You can probably just do that on that chair.
Patellar
right there.
mobs?
Patellar mobs, yeah.
Yeah. So this
Patella is kneecap.
I
by the
just
way.
had someone with knee pain. She came in and she was in her 50s. She had knee pain, no apparent reason. And this is one of the exercises I had her do. I had her do the pressure on, pressure off, and her kneecap was a little tight. So when you do this, it's critical that you completely relax your leg. Your quadriceps must be relaxed. Can you see that movement there, Liz? Yep, that's the patella kneecap.
He's making that look easy. A lot of people, again, they tighten up and
Yeah.
so it's really hard to move.
See, if I tighten it, it doesn't move at all. So it's like relax, relax. All these muscles relax. And I'll take the kneecap, move it up and down, and right to left. And you can do some diagonals
Yeah.
on there as well to make sure you cover all the bases. Again, if this, sometimes in one direction, it may be painful. You go pressure on, pressure off. After 3 or 4 repetitions, if that pain starts to get relieved, go away, then you keep working it. If for some reason it just continues to irritate it and the pain goes up after 4 or 5 repetitions, then you would avoid that particular direction and work the pain-free
We're not big
direction.
believers of making your pain worse. Let's
Right,
put it that way.
yeah.
So, all right,
Very
for a
good.
long-term fix, Brad, this isn't something that's going to give you a quick relief, but this is like after you've maybe done some of these, you want to get the knee stronger.
Sure.
So one way to do that is, do you want to kind of clear things off for the ball over there, Brad?
Yes, I do.
While I'm showing this.
Yes,
So, you can start just real simple, some straight leg raises. So I'm strengthening the knee, strengthening the hip a little bit too, but you can go ahead and just bring this leg up. You're laying down, and you're going to start strengthening that quadricep. You've tightened up that muscle there, and you can go. You can do a good set of 20 to 30 of these if you want.
If you can.
If you can,
yeah,
yes.
that will be challenging if you haven't done it before.
Yeah. So, and then you can even go to the side. I'm strengthening this one now, and you can go ahead and do some of these. So now you're getting the IT band that's going across the knee, and you're strengthening that a little bit. You can go and flip over onto the stomach and do some of these. So we're kind of working 3 ways here. Getting a little bit of hamstring now and working it that way.
So we're not only working the muscles at the knee, but the hip as well.
The hip too.
They all work together. You want to not particularly isolate, but get the whole leg stronger.
I can't tell how many times I find a patient that who's having knee problems that they also have a weak hip.
Right.
So it's not uncommon at all.
I got it cleared away, Bob.
All right, thank you.
Just
I appreciate
wait,
that.
just wait.
Oh, look at this.
Which one?
Well, whatever, you choose. There we go, look at that.
There you go.
Oh, so now we're over to the wall here, and this is just a great way to do some strengthening of the knee. You can do some shallow wall squats. And so what I like about this, and Brad's going to show you right now, this keeps your knee from going past the toe when you're doing the squat. Normally for the squat, it's real easy to do it like this. Now watch how the knee has gone past the toe, and that puts more stress on the knee. So I'm right here. I can do shallow squats. It's real easy to do. And if it feels better, I can go a little bit deeper.
Right. As long as you keep that knee behind the plumb line of the toe. So the ball really takes stress off the knee because
it does.
accepts weight, allows you to be relaxed. If you need something to hold on to because you haven't used the ball, get a chair, or you could have a stick there.
You want to make sure your feet aren't going to slide too. So, I'm sorry. So here we go. We can go ahead and do, you can rip off a good 20, 30 of those if you want. I do 30 at a time.
As long as your knee is tolerating it. Right.
Also, don't have your knees going in like this when you're
good
doing
point.
it. Have them kind of out a little bit like this while you're doing it, because this will often make your knee pain worse too.
Sure, you want that alignment.
All right, looks like time's just about up, so thanks everybody for watching. Take care.